Good evening. Tonight we're going to talk about community and public health. So, first, we're going to talk about table of content. We're going to go into roles of community and public health in the well being of populations, the public health organizational structure, legal and ethical dimensions of public and community health services, funding of public and community health services, and of course, role of communication in community and public health programs. Now, the role of community in public health in the well-being of populations. Public health is the science of protecting and improving the health of community through education, promotion of healthy lifestyles, and research for diseases and injury prevention. In a way, public health is a large entity that has many forms. As you can see here in this listed below, it can be into behavioral science, biostatistics, emergency medical services, environmental health, epidemiology, and so forth. It lets you know that public health and community health is it's a key player in how the community as a whole is effective and it's affected by any health issues or concerns there might be. Now, let's see some of the roles. The roles of public health professionals refers to professionals in the academic world, but are taking into account the fact that many public health professionals are government employees themselves. Now, this lets you know that the roles of public health is not a privately owned organization. It is a government-owned entity. So, anything and everything that comes out of a public health facility is for the better good of the community. It is not just for profit making for an individual. As you can see, public health in the bottom here is like a intricate bubbles where it talks about the health promotion, surveillance, monitoring, analysis, outbreak, epidemics, disease prevention, communication, and risk. Those are all key roles and responsibilities that public health professionals are responsible of and are needed to communicate that to the community so they are aware of everything that's going on. Now, a secondary role of public health is to look after the entire population rather than just one individual. See, some of the things they have, we're talking about infectious diseases and educate on healthy eating habits. Infectious diseases. See, in my community, I used to see where they had the outreach workers that will go out and actually doing vaccination for tuberculosis. In those that had an duration larger than 5 centimeters, will actually refer to the local hospital and giving vouchers even for taxi if they didn't have transportation. So these outreach workers were there just to stop the spread of tuberculosis in low-income families and low-income communities and those who cannot afford actually go for a doctor or regular checkup. Now, for education and healthy eating habits, they have run seminars. They educate parents on how to better feed their family and show some healthy choices and try to unmask some of those quote-unquote nutritious food out there that are really not so nutritious for you. Yeah. Now let's talk about the public health organizational structure. As you can see in this massive chart, the health organization is ginormous. It goes all the way from the secretary, deputy secretary, chief of staff, all the way down to your individual outreach workers, the person that's actually making the knocking on your doors and trying to educate or trying to pass any health concern for the community. So as you can see, it's a massive entity. Legal and ethical dimensions of public and community health services. Let's talk about rights. Everyone has the right towards everything. We have come very entitled, if you ask me. For example, people have the right to contraception. At the same time, they have the right of vaccination and the right to smoke if they want to. However, there are some groups that are opposed to some of the to these rights, and they feel that the health community, the organizations of the public health, is kind of running into people's rights, so to speak. I'm going to talk about Planned Parenthood. There are some religious groups that are against contraception, that don't believe that the government should take any part into determining whether a mother should give birth or not to a child, or whether a teenage girl should be given birth control or contraception. As you can see, it goes more into actually protecting the community as a whole by reducing the number of unwed mothers, reducing the number of abortions, or so forth. Planned Parenthood assists those and give guidance to those who might lack some. Now, vaccinations, for example, even though vaccinations have eradicated many diseases such as polio, smallpox, and so forth, there are some who still oppose the vaccinations. They feel that there should not be mandatory to have vaccinating a child at a certain age. They should not be. They're saying that the flu vaccine, for example, it should not be mandatory for school children to get flu vaccine. Well, if you look into from the point of view for the health community or the public health, they're trying to stop the spread of diseases. So that's why they're trying to working towards having this vaccination program. The last topic I want to cover is it's a hot topic, and it talks about regulating tobacco use. Of course, everyone knows you have the right to smoke if you wish. At the same time, I have the right of the freedom from smoke if I don't want to be around smoke, secondhand smoke that is. So having designated smoking areas, or now the government is trying to limit smoking in public parks, feels that it's impeding some of the people's rights, the community's rights. However, it is not just for the one individual who wants to have a puff of smoke. It's more for the children, for those who don't want to be around secondhand smoke, and the side effects that come with it. Now, talk about funding of public and community health services. It's all about money, money, money. Health centers rely on state government funding to sustain operations and serve increasing numbers of uninsured patients due to economic downturn. The National Association of Community Health Centers work closely with the Primary Care Association to document for legislators to service that might be lost with funding cuts or sustained and expanded with additional state support. Given that, as you can see here in funding, according to an assessment conducted by the National Association of Community Health Centers, 32 states will appropriate a total of $379 million in federal fiscal year, in state fiscal year. So if you go into the chart underneath, just copy into the hyperlink, you will see how much each state actually spent into the healthcare system. Now, some of the issues are the rise in medical costs is making it difficult for community centers to provide affordable, high-quality care that they strive for. And of course, after you talk about the future, okay? In the future, you can see that the NACHC is working towards reducing the medical costs and trying to increase those who are uninsured. We're trying to get rid of the 45 million uninsured people we have in the United States right now. The role of communications in community and public health programs. Communicating in community health takes various forms. So, in order to get the word across, the public health or outreach workers may use public announcements. They use pamphlets, leaflets, anything that you see when you're in the hospital waiting room. They have all these nice little fold-out sheets about tuberculosis, STDs, and condoms, and so forth. Those are all methods of communicating with the community. The main purpose is just to spread the word and to inform the population of all health matters affecting the community. In a way, communication is the core of effective public health. As you can see now, we have advancement in technology where now you have email format. Emails can be sent to anyone that registers anywhere. You have emails, you have social forums, anything that just spreads the word. That's basically where communicating with the community is a key role in the public health. Now, so we talked about communication, budget, talked about the actual structure, talked about some of the roles and key responsibility, and a brief overview of what public health really is about. And here are some of the sources and information where I gathered my information for the slides. Well, thank you very much and have a good evening.